Hello everyone, myself Saurabh Datta, a student of Lakhimpur College of Veterinary Science, 4th professional year, shall be discussing on the topic parenteral administration of drugs in pigs, prepared and presented by myself. Now, before we proceed further to our topic, this is a disclaimer that this presentation has been prepared by the UG students of Lakhimpur College of Veterinary Science, AU Johing, Assam. Therefore, the information collected by us may not corroborate with the findings of the deep research work carried out in the respective field. However, utmost care has been taken by each student to provide correct information. No information of this presentation should be considered for scientific work without cross-verifying this information. It has been prepared only for educational purpose and not for any commercial purpose. Further, the information in this presentation should not be used for the treatment without consulting a registered practitioner. With that being said, let's move to our today's video. So in this video, we will discuss some information about parenteral administration of drugs, then different routes like intramuscular, intravenous, and subcutaneous injection of drugs. The word parenterals basically comes from two words that are par means beyond and enteral means intestine. The term parenteral administration implies the routes through which the drug directly reaches the body fluids, bypassing the digestive system. The basic equipments we need for a parenteral administration that includes needles, syringes, ampoules or vials, and solutions. There are several routes of parenteral administration of drugs, but in this video we will be discussing mainly three types: intramuscular, intravenous, and subcutaneous administration of parenteral drugs. Firstly, we will be discussing about intramuscular injection. So an intramuscular injection is a technique used to deliver a liquid medicine deep into the muscle. Purpose of this injection are: this allows the medication to absorb quickly than the oral route of administration. Then, intramuscular injection is given to administer medicine that are not suitable for intravenous medication. Then, to avoid unnecessary wastage of medicine, this intramuscular injection is preferred. And lastly, it is a comparably convenient method for parenteral administration of drugs than the oral route. Here in this picture, the site of intramuscular injection, that is the neck muscle, is shown. The procedure for intramuscular injection are: firstly, we have to ensure that the animal is properly restrained. Then, one who is giving the injection should wash the hands and wear gloves. Then, the selection of site should be done. The most preferable site for intramuscular injection is neck region, and sometimes the caudal thigh region can also be considered for intramuscular injection. Swabbing of the area should be done with spirit swab to maintain an aseptic condition. Penetration of the injection needle at an angle of 90 degree is to be done. Then we have to check for presence of blood in the injection by drawing back the plunger. Then after confirming, administration of drug is to be done. And lastly, removal of the injection and apply a spirited swab to be done. The whole procedure can be easily understood by looking into a video. So let's proceed for that. Let's take a look what precautions we have to take during an intramuscular injection. The intramuscular route should not be used in cases where the condition of muscle size is not preferable to support the sufficient uptake of the medicine. The intramuscular injection should not be given at a site where there is sign of pain. A small volume of 15 to 20 ml drug should be administered at a single site, not more than that. One should follow proper sanitation and hygiene at the time of administration of drugs. Select the suitable needle size for the drug chosen as per the viscosity of the drug. Use a new needle for every injection to be given. Then don't use a bent or contaminated needle. Let's take a look at another method of parenteral administration of drug, that is intravenous injection. An intravenous injection is defined as an injection made directly into the vein or infused via an IV line for large volume of drugs to be administered. The purpose of this intravenous injection are to get a rapid and systematic effect of drug. Large quantities of drugs also can be administered through this method. We can use it in emergency situation. To get a need effect, even the patient is unconscious, that is in anesthesia, we can use this intravenous injection. And to avoid any gastric manipulation, we can also use this intravenous injection. In this picture, site of intravenous injection is shown. The ear vein at the ear pinna was engorged by applying a spirited swab. Then the needle is inserted. The steps to be followed for giving an intravenous injection. Firstly, we have to locate the site for intravenous administration. In pigs, that is the ear vein. The ear pinna, where the intravenous injection is to be administered, should be made aseptic by rubbing with spirit swab or betadine swab. The vein should be properly engorged. The sterile needle of injection or scalp vein of the IV set should be gradually inserted and guided inside the engorged vein. Then draw back the plunger of injection to ensure the needle is in the vein. Then administration of drug is to be done. And lastly, withdrawing of the needle or scalp vein and slight pressure is to be given by finger to the injection site with a spirited swab after giving the intravenous medication. This can be easily understood by a video, so let's just head over to that. The precautions to be taken in intravenous administration of drugs are the shaving of the site for proper engorgement of the vein should be done. Then it should be ensured that there is no air bubble present inside the injection or the IV set. Proper restraining of the animal is very necessary. Then lastly, the needle should be checked for through and through. Next up, we will be discussing about subcutaneous injection technique of parenteral administration of drug. Subcutaneous injection is the administration of drug under the skin in the subcutaneous tissue, that is, under the dermis. The purpose of this subcutaneous injection are, it is a safe and easy route for administration of drugs. This works for prolonged duration of action. To cover a greater area of target injection site, the subcutaneous injection is preferred. And to lower the chances of systemic infection than the other method of parenteral drug administration, the subcutaneous injection is preferred. The site for subcutaneous injection is chosen where there is loose skin in any part of the body, but in pigs, the most preferred site is just behind the ear at the neck region. One can give a subcutaneous injection by tenting the skin. The procedure for giving a subcutaneous injection are: firstly, we have to select the injection site, that is, the skin flap just beneath the ear is the most preferred site for subcutaneous injection in pig. The area should be made aseptic with the help of an alcohol spirit swab where the injection is to be administered. By tenting the skin, the needle should be inserted and care should be taken to ensure the needle will not pierce the skin. The drug should be administered after that. The needle should be removed after administration of drug and a gentle massage should be given at the area. The whole procedure can be easily understood by looking into a video. So let's proceed for that. The precautions to be taken while giving a subcutaneous injection are: the proper restraining of the animal should be followed. A large amount of drug should not be given at one time. The needle should not exceed the subcutaneous layer of the skin. One should avoid the sites that are bruised, hard, or swollen. Then sometimes hypersensitivity reaction may occur also, so care should be taken for that. These are some references from where I have taken the information for this video. Lastly, thank you all for your patient listening and have a nice day.